here to update the public in St. Francis County on the recently reported first positive case of COVID-19 in St. Francis County. My name is Elliott, and I am the director of the St. Francis County Health Center. And I just want to provide the public with some updates in regards to that case and talk a little bit about some other things that are happening in the county. So this case was reported to us yesterday at approximately 2 p.m. The case is a female, and she is in her 30s. This exposure is not related to the Voluntary wedding. This person is a healthcare professional that was exposed during her line of work to a patient in another jurisdiction who is positive for COVID-19. This person does not work inside our county. We have begun our epidemiologic investigation, which includes identifying close contacts to this person and retracing their steps as to where they've been since their exposure and since they've become symptomatic. This person became symptomatic on last Wednesday and was tested on Friday. Her test was resulted yesterday. It was completed by the State Public Health Lab. She is currently recovering at home. We are working with the state to also get a list of the places that she's visited through her line of work, and working with her to do that as well. And we will be reaching out to the state to contact those places that are outside of our jurisdiction. Epidemiologic investigations are a normal part of what we do here at the Health Center. We regularly contact trace for communicable diseases. So this is not a new process for us. We will be continuing to work on this case and make sure that her close contacts are in quarantine 14 days after their last exposure to this case. This person has been very cooperative, and we expect that she is on her way to recovery. She will remain in isolation until 72 hours after her recovery. So that means that she's free of symptoms from COVID-19 without the use of fever-reducing medications. And it's 7 days past the onset of symptoms. That is the current CDC guidelines. We will not be releasing any personal information about this person. We are contacting the close contacts of this patient. Close contacts constitute people who have been in contact with a confirmed case within 6 feet distance for 15 to 30 minutes at a time. So it can't be just as much as even sharing an airspace in a large room. You have to have some close contact. And so we are working on that, and we'll continue to work on that. We always, in public health, have to toe the line on patient privacy and also public information. The people that need to know that they were exposed to this confirmed case will know. But we want to maintain patient privacy, and we want to maintain her safety as well. An update on the Voluntary wedding situation that we reported on Friday night. The Health Center has contacted over approximately 50 households that were in attendance at the wedding. There is a possibility that people that were not on the guest list, there were people that we don't have contact information, there's a possibility that they were at the wedding and we may not know that. That is the reason for the release in the Daily Journal, to alert people who attended that wedding at Heritage Hall on March 14th. They were potentially exposed to 2 cases that were confirmed outside of Missouri. Those people reside in another state. Those people are asked to quarantine through March 28th, because that is 14 days past the exposure. Anyone who develops signs and symptoms of COVID-19, fever greater than 100.4, cough, or shortness of breath, should call their healthcare provider. Or if they become urgently ill with shortness of breath and other emergent symptoms, they should contact their hospital before coming. Our hospital has been preparing for this for weeks, over the last month, and they are ready to deal with this situation. But to prevent any exposures, we ask that you call your healthcare provider or your hospital before visiting them. Out of the people that we have contacted in relation to this voluntary wedding, 2 people have reported signs and symptoms. Both were tested, one of which was negative, the other is pending. I want to explain a little bit the difference between quarantine and isolation. So isolation is isolating a case that has been confirmed. And quarantine is quarantining or self-quarantine, so they are asked to stay home for 14 days past their last exposure. So these are people who are well, but they've been exposed and they have a chance of developing the disease. People who have been in contact with someone who is in quarantine, that does not mean they need to quarantine. Only people who have been in contact with a confirmed case need to quarantine. We expect to see more cases this week as testing capacity increases. Most of our providers are testing. They use their clinical judgment along with other tools provided from the state to decide if someone needs to be tested. If someone is going to be tested by the State Public Health Lab, it has to be approved through the State Public Health Lab. We do have private labs coming on board and other labs in the state coming on board to test, and that will increase our testing capacity greatly, but we do expect to see more cases. So far, the State Public Health Lab has tested 6 St. Francis County residents. 1 has been positive, the one that I spoke about earlier, and 4 are currently pending. We also have had providers send out to private labs, more than 10. We do not get all of the numbers when they send out to private labs, but we know there's been more than 10 sent to private labs. All testing that has been resulted at this time has been negative, other than the positive case in which we've alerted the public about yesterday and I discussed earlier in this video. As of tomorrow, we will begin doing Facebook video updates daily at 2 p.m. Also a Facebook post about updates and what's happening in the county. We will be providing media updates on Monday, Wednesday, and Friday at 2 p.m. as well. We put information out on our Facebook. We are working to update our website, and we also release information via the Daily Journal and our local media sources through the radio. We ask that if you have questions for the Facebook video updates, that you submit those on our website, sfchc.org, on the Contact Us tab. Please submit those by 4 p.m. the day before. So we're going to do an update tomorrow on Tuesday at 2 p.m. Please submit your questions by 4 p.m. today. I want to discuss a little bit about the governor's order that was released on Saturday. This includes avoiding social gatherings of more than 10 people. Social gathering is a planned or spontaneous event convening that would bring more than 10 people together in a space at a time. We are asking people by this order to avoid those social gatherings. Avoid eating or drinking at restaurants, bars, food courts, provided that the use however, you can use drive-through pickup and delivery options. Please do not visit nursing homes, long-term care facilities, retirement homes, or assisted living homes unless to provide critical assistance. Schools shall remain closed. This order does not prevent people from visiting a variety of places, including grocery stores, gas stations, parks, and banks, so long as the necessary precautions are taken to maintain and reduce the transmission of COVID-19, maintaining 6 feet of distance between individuals that are not family members. If you go to the store with your family, you don't have to be 6 feet apart from your child, your husband. It is family to family. For offices and workplaces that are remain open, individuals shall practice good hygiene and, where feasible, work from home in order to achieve optimal isolation from COVID-19. The Missouri Department of Health has charged the local health department with carrying out this order and enforcing this order by civil proceedings. This is important for everyone to follow this order and the 15 days to slow the spread that we have been recommending over the past since last week from the White House Coronavirus Task Force. These things will save lives. You may not know that you are are saving a life, but you are. We know that over the past few weeks, Missouri has not had the great capabilities to test. As that increases, again, we expect to see more cases. It is imperative to prevent the surge to our hospital system, to allow them to take care of patients. Again, this will save lives. The recommendations are changing every day, sometimes by the hour. We will do our best to provide that to our partners, and we will provide that to the public. But what we ask you is to stay home if you can. Older people, elderly people who are above the age of 65, stay home and stay away from other people. People with immunocompromised systems and other conditions such as lung conditions and heart conditions, we ask you to stay away from other people. We ask you these things not to bring mandates or to force people to do things. We ask you this to protect the community. This is not something one agency is going to be able to do on their own. It is going to take every last one of us. We know that this is a hard and stressful time, and there are many unknowns. And we know that people are concerned and have many anxieties regarding the situation with COVID-19. I know you've heard this before, but this is an unprecedented event. This is something that we have not seen since the 1918 flu pandemic. We are going to all have to work together. Our agencies are working with other agencies and partners in the community. We want to prevent the spread of this disease and to slow the spread in the community. Again, we thank you for your time. We thank you for your cooperation. Please reach out to the Health Center if you have questions about how we're responding to COVID-19. I would also ask you to visit the Missouri Department of Health and Senior Services to see the cases, that number of cases that are in Missouri currently, and visit the CDC for information on COVID-19 for frequently asked questions. The state still has their 24-hour hotline up and running. That hotline is 877-435-8411. That hotline has been overwhelmed many times, and so you may have to wait for a long time or call back. But please call the Health Center if you have questions related to the local response. That's all I have for now. And we will be doing individual media updates here in a little bit with our partners who are in the room. We appreciate your time. And again, I ask you to please follow the recommendations that have been put forth by the governor and the recommendations from the White House Coronavirus Task Force. Thank you.